Good afternoon, everyone, and welcome to a special session of Moving Beyond the Stigma, Mental Health and Employment. And we are excited to have you all here today with us. My name is Amy Julian, and I'm with the Illinois Center for Specialized Professional Support at Illinois State University. And I'll be your moderator for today's webinar. Just a reminder, all participants are in listen-only mode. If you have questions as the webinar proceeds, please post your question in the question box. In addition, if you would like to speak and your microphone is working, you may raise your hand and we will unmute you. We'll be pausing at different times for questions. A reminder, this webinar is being recorded and the presentation recording will be available on the ICSPS website. Actually, yes, we are recording this. And tomorrow attendees will receive a follow-up email which will include surveys asking about today's webinar. Please provide feedback on those surveys so we can help improve our service delivery to all of you. With that, just a couple things here to get us started. We'd like to know where you are at. So we know we're talking to the state of Illinois today, but I'd like to know where we're talking to in the state of Illinois. So if you can post in the question box there what your local area is, go ahead and post that in your question box. All right, great. We've got quite a few coming in. I'm going to let you continue to post that as I ask a second question here. Oh, the second question was, what area are you representing? So we have local area 7. Some of you are saying that you're from Western Illinois, Rockford. Great, thank you. And if you want to say what, if you're with Title I, Title II, Title III, Title IV, or another stakeholder, you can enter that as well. Fantastic. Thank you all for joining us today. We're excited to have you with us. And I am going to, at this point, hand the floor over to our other moderator. This session is moderated by myself from the Illinois Center for Specialized Professional Support, who is bringing you this session as part of WIOA Professional Development, and by Ashley Hamilton, who is the Frontline Focus Program Manager for Chicago Jobs Council. So with that, I'm going to hand the floor over to Ashley.
Thank you so much, Amy. Hi, everyone. Good afternoon. My name is Ashley Hamilton. For those of you who might be new to the Chicago Jobs Council, we are a 39-year-old member-based organization whose mission is to help people out of poverty through access to quality employment. We are not a direct service agency, but the way that we go about this is doing policy advocacy at both the city and the state level to remove systemic barriers keeping people from access to quality employment. The other way that we go about this is through our capacity building initiatives, such as the Frontline Focus Training Institute, which offers trainings, such as this one, to make sure that all the individuals who are on the front lines, such as yourselves, have all of the tools and resources that you need to be able to connect your participants to quality employment. Today, we're very fortunate to be joined by my colleague, Venantia Bate Ambrose, who's going to be our facilitator today, walking us through Moving Beyond Stigma, Mental Health and Employment. So without further ado, I'm going to turn it over to Venantia.
Well, good afternoon, everyone, and thank you for joining us today. Again, I'm Dr. Venantia Bate Ambrose, and I'm really pleased to be with you today. Next slide, please. So I just wanted to tell you a little bit about me. I began my career as a community health worker, also known as promotora de salud in Spanish, for anyone who's familiar with that. I went from being a community health worker after having several years in nonprofit to ultimately becoming a community health psychologist and a pastoral counselor, specializing in diversity, equity, and inclusion, spirituality, and healthcare ethics. I have a very eclectic therapeutic background, meaning that I pull in a little bit from a lot of different really good resources in order to suit the client's needs. I have over 18 years of experience in nonprofit health and human services, including 10 years in organizational leadership and consulting, and 5 years in healthcare workforce development and training. I'm also a visiting assistant professor and have served as an adjunct professor around many universities and colleges across the Chicagoland area. Next slide, please. So I just wanted to go over the agenda with you. The introduction was already done. We'll be setting the context for Mental Health 101, this type of training. We'll talk about mental health in the workplace quite very much to a large degree, because mental health in the workplace is so very crucial because it affects your ability to perform as well as your ability to work on a team with other members. Also, we'll have a question and answer period and wrap up an evaluation. There will be polls throughout the presentation, so I look forward to getting your feedback on the questions that are asked throughout. Next slide, please. So we're going to start off with a centering and grounding exercise. It's really just something to set you in the mood for today's training and to really separate yourself from the other activities that you may have been involved with earlier in the day and may still be racing through your mind, but it helps us to center and focus on today's training. So if you wouldn't mind, if you're comfortable, please get comfortable in the place where you're sitting. So if that's your desk chair, your couch, your love seat, what have you, just settle in, close your eyes if it's comfortable and safe to do so, and then breathe in through your nose and out through your mouth, slowly. Let's try that again. In through the nose and out through the mouth. One more time. In through the nose and out through the mouth. Now open your eyes, enjoy a feeling of relaxation and clarity, and let's engage on today's learning experience. Next slide, please. So, mental health in the workplace. It's affected by many things in 2020 that we haven't experienced at really any other point of our life, and the combination of those effects. So when we think about what's really affecting mental health right now, well, clearly COVID-19, and the effects of COVID-19 are multiple. They include physical, emotional, psychological, social, spiritual, and economic. And when you overlay all of those things, it can create a lot of stress for a lot of people. So it's really important to have mental health practices, self-care, things that you utilize for your own well-being to get you through and to make you a more effective and functional employee, person, family member, all of that. So next slide, please.
Did you want to do the poll for the slide 8?
Oh, yes, please. So in terms of mental health, when you think about people with mental health, can they be productive workers? True or false?
We'll give everyone just another second or two to respond. We have quite a few responses coming in. Again, your polling is located down there by your handouts. And just a heads up to everyone, this was something I apologize I missed. In your handouts is also a copy of this presentation in a PDF. So if for any reason you lose connectivity at home, you can follow along with the PDF. All right, looks like the votes are in. So I'm going to close the poll and share.
Wonderful, that's great. That's absolutely correct. People with mental health conditions can be very productive workers. Next slide, please. So we're going to attempt to show a video now, and we hope that the audio is clear for you, but in the event that it is not, we actually have embedded these links to these PowerPoints within your PowerPoint.
The protests that we've been watching. It's never been
So perhaps we'll skip the this particular video, and hopefully there might be better audio with the next one we show. So I'll just tell you some of the things that you'll see when you actually have an opportunity to view this particular YouTube clip later. It's people from diverse backgrounds talking about what they do for self-care. So some of the practices that they talk about include the importance of staying socially connected with other people. And in a time where social distancing is necessary and prevalent,
My apologies, it's not letting me exit. 1 second.
let me know if you'd like me to still continue talking through while we work on the technical issues, or if I can still be heard.
You can still be heard and we're ready to go. Sorry.
Okay, no worries. So again, some of the tips that I wasn't sure if you were going to try it again or if you wanted me to talk through the slide.
Go ahead and talk through the slide because that one didn't.
Yeah, so again, some of the tips that are provided by the healthcare providers in this video include the importance of remaining socially connected to others, even if that's being socially connected through social media. But the flip side of that is that we can have social media overload and sometimes we need to disconnect. Other practices include spirituality, whatever that might mean for you. So it could mean meditation, it could mean prayer, it could mean communing with nature, making sure that you are attending to your exercise or daily activity levels, that you're at least, trying to get out and about and having some sort of movement throughout the day so that you're not sedentary all day, making sure that you're getting ample rest and that you're eating properly. So these are all tips that we really need to integrate, especially in times like this where there's a high amount of stress that's prevalent, not just for the individual, but it's really in the ether, it's in the community, it's in our country, it's in our world. So how do we cope with that? So it's important to consider those things when we think about what work looks like in 2020. Next slide, please. So I'd like to just talk about myths. So when we look at myths and defining mental health and mental illness, health and illness are on a continuum. So health clearly is, optimal. That's where we want to be. And when we look at mental health, we're talking about emotional and psychological, social well-being. It affects how we think, how we feel, and how we act. And it also determines how well we're able to utilize our coping mechanisms, which help us to handle stress, help us in our interpersonal relationships, even help us make, decisions that are good for us rather than being so stressed out that you're not contemplating your choices fully. So again, mental health is a really important factor of our overall health, and it really shouldn't be disconnected from other aspects of self and other aspects of health. Mental illness is the other end of the continuum. So when we're looking at mental illness, we're really talking about clinical diagnostic disorders that can be found in the DSM, which is the manual that mental health care providers utilize. So we're talking about mental health disorders, sometimes referred to as mental health conditions, and these things do affect your mood and your behavior and your perceptions. So it's important to be aware of them. I don't actually see where the slides are in the, where the polls are in the slide. So when you see a poll is coming up, just feel free to go ahead and give it. So many people in US society have one or more adverse childhood experiences. That one, actually, we can go ahead and try and guess if that's true or false. I think this might have appeared later at some point in the presentation where you actually have a little bit more information about adverse childhood experiences. But if you've ever heard the term before and you know what it is, please feel free to go ahead and try and answer that. Do you think that people in US society have one or more adverse childhood experiences? So really poor or traumatic things that have happened to them in their childhoods. Correct again, that's true. You know, I'm not going to go Freudian, and I'm sure many of you have heard the cliches about, you know, blaming the mother and that sort of thing, which is, you know, some of the stereotypes in psychology. And no, it's not about blaming any particular, you know, family member. We all have different experiences throughout childhood that may occur in school, whether it's bullying, it could be death or divorce in your family of origin. It could be being moved out of your family of origin and having no control over that. It can also include a parent, you know, being sent to another country in the military, being deployed somewhere, especially somewhere that's not safe. It can also be perhaps there's someone in the family that you know, has mental health issues or has substance use issues. So there's so many different factors that contribute to adverse childhood experiences. Next slide, please. So do you want to try and do the mental health? So for this particular clip, we really didn't need the audio. It was just background music. And it really addresses some of the common mental health myths and stigmas that are out there. And it really addresses them quite nicely. Goes back to one of our previous questions about whether people with mental health conditions can be productive workers. Clearly they can. Some even manage to hide their symptoms from others around them in the workplace, which, you know, may make you a better functioning employee on some level, but it doesn't do any service for your mental health if you're not able to reach out to someone and say that you need help. So again, the idea that there are many mental health sort of myths that are out there, and it's all of our responsibility to really combat those myths. When we look at the myth of violence, in fact, actually, I'll just use a current situation that I heard on the news just yesterday when they were talking about the social unrest and the looting that was occurring here in the city of Chicago. One of the local politicians automatically went to, well, we don't know who's doing this. It could be people with mental illness. It could be people with substance use. And I mean, you should have seen the hairs on the back of my neck literally stand up, because it's like it's easy to scapegoat people who have mental health conditions or who have substance use, which is a different issue. But it's easy to make those folks the scapegoats for when violent things happen. And oftentimes, more often than not, someone who has a mental health condition is more likely to be the victim of a violent crime or even a property crime, as opposed to being the perpetrator. But again, common myth. Next slide, please. So when we look at Mental Health 101, it's also important to consider trauma-informed approaches to adverse childhood experiences. So you all were quite correct with your assessment of the poll previously. The adverse childhood experiences, really there was a study that was conveyed from about 1995 to 1997 with individuals who had HMO from Kaiser Permanente. So they just embedded it as part of their primary care exams and had them, you know, fill out these surveys to really ascertain whether the effects of adverse childhood experiences on current health conditions. And so what they found was that the more ACEs an individual had, the higher likelihood for a multitude of different medical conditions, not to mention behavioral health conditions. So again, really looking at the impact of those experiences in present functioning, which is why it is so very important to actually get the care that you need, preferably while you're experiencing them as a child, as opposed to carrying that into adulthood. But if you didn't have that opportunity due to lack of access, stigma, or some other reason, you definitely should avail yourself of counseling or other types of therapeutic services to help deal with the adverse childhood experiences so that you can improve your overall health and functioning. So another term that's really important is trauma-informed approaches. Trauma-informed approaches or trauma-informed care, it's not a therapy and it's not, a set of actions or a specific action. Really what it is it's an approach to engaging people that recognizes that many of us have had adverse childhood experiences, and in order to not re-traumatize the individual, we want to make sure that we're being open and that we are not using traumatizing language and that we are not using traumatizing nonverbal expressions that might leave the individual feeling vulnerable or weakened in some way. We actually want to be supportive and to provide a safe, strength-based environment. So we can attempt to take a look at the next video clip if you wish. Otherwise, we can go to either a poll or the next slide. Unfortunately, we don't have the audio, but I think everyone can see the captions at the bottom. So I hope everyone was able to see the closed captioning there. And again, apologies for the technical difficulties with the videos. They are all embedded in the PowerPoint presentation, so you'll be able to view them later. But the overarching theme here is the importance of using welcoming and not traumatizing language. So not saying, what's wrong with you, saying rather, what happened to you, or tell me about your experience. Because it's not stigmatizing language, it's opening and empathetic language. And that it's important that no matter who it is in the organization, in this video, it's in a healthcare setting, but trauma-informed approaches can be practiced in any setting, human service, social service, government, wherever. And it's something that should be utilized all the way from your CEO of your company to the frontline worker, to the security guard or the receptionist, because at any of those points, there can be traumatizing language if the person doesn't understand the importance of using a trauma-informed approach. And I think as we move forward, we will just forego the rest of the videos in this presentation, please. Next slide, please. So this is the segment where we really start talking about what mental health disorders are. And the DSM, I don't know if anyone's had any experience or taken a psychology class in the past, but it's a really huge manual. So we're not going to cover every single mental health disorder today in this presentation, but we'll be talking about 3 that are very common in the United States. So depression is one of them. For a person to be clinically diagnosed as depressed, they have to have 5 or more symptoms, again, over a 2-week period, and at least one of those symptoms has to be depressed mood or loss of interest or pleasure. So loss of interest or pleasure, it's something that you may be able to see in addition to depressed mood, but if you're working with a client or you're working with a colleague that was always, had friendly, joking, very amiable person, and then all of a sudden, they're very quiet, they're sullen, and things that they would enjoy. So if someone enjoyed playing guitar in a rock band on Friday nights, that was like their high school dream, and it's something they've been doing since then, and all of a sudden they're like, man, I don't want to go do that anymore, I just want to stay home. Other things like that people take pleasure in, whether it's going to church or going bowling or whatever people derive pleasure in, if all of a sudden you see a loss of interest or pleasure in those things, that can be symptomatic of depression. The slide you would have seen here talked about different aspects of depression. So I'll just name a few of those. So some of the symptoms that you can also recognize, and it's really interesting because when we look at some of the symptoms, they can really go to either end of the spectrum. So for example, let's take sleep. It's very important as part of your overall health, including your mental health, to have adequate sleep and good sleep hygiene. But a person who's depressed may all of a sudden be sleeping much more than they ever had. That's all they want to do is just lay on the couch and sleep. Or conversely, they can't sleep at all. They're tossing and turning all night. They're watching the TV. They're watching infomercials all night long or doing whatever, counting sheep, because they just can't go to sleep. So that's one of those symptoms that could go to either extreme. Food is another one. Another sign of depression, people may, again, loss of pleasure, loss of appetite. They might not enjoy food anymore and just simply stop eating. Similarly, it could go the other way, where they're just, they're trying to cope with their stress and they're using food as a defense mechanism. So they're just eating. And you might see associated weight gain or weight loss depending on how food manifests or how appetite manifests with this particular disorder. Next slide, please. So what you would have seen here is a short film about anxiety. There are different types of anxiety. Specifically, generalized anxiety disorder is characterized by excessive anxiety, worry that occurs more often than not. And it can manifest in a variety of different activities or events. And you really see that the person has a lot of difficulty in concentrating and in functioning, because really all they're doing is worrying and experiencing both mental symptoms of anxiety, which can be, difficulty in concentrating, or just having your mind all over the place, not being able to focus in on one thing. Or it can be physical symptoms, which may include heart palpitations or shortness of breath. Some of those things we also see in conjunction with panic attacks. So it's not uncommon for someone who actually has anxiety disorder to also manifest panic attacks. And so we'll talk a little bit more throughout the presentation as to how you would deal with that if you had a client that was having an active panic attack right in front of you. Next slide, please. So the other common disorder that we see is post-traumatic stress disorder, which really is a serious mental health condition. It's sort of an overstimulation of the nervous system, a high sense of arousal, and it's very difficult for the individuals because they know that oftentimes they know their own triggers, and so they'll try to avoid situations, people, areas where they know those triggers might occur. And so PTSD occurs after witnessing some type of violent or traumatic event. And oftentimes when we think of PTSD, we think about people who have performed military service. And it's not uncommon to see the disorder among people who've been in the military and who have been deployed into areas of high violence. But that's not the only population that PTSD occurs in. PTSD can occur if you live in areas of high crime where there are gunshots all around you and you're constantly living in fear of when it's going to come through your window. You may have experienced some sort of other type of physical violence. It could be sexual assault. In fact, one of the persons in this video actually explains that she had been sexually assaulted, and then that's when her PTSD occurred. Another person in this video talked about living in another country. I believe it was Iraq, and she was living in a wartime. And so again, that's when she developed PTSD. So again, it's not just a military condition. So I want to dispel that myth right away, that it doesn't occur just with people in the military. And because we have such a pervasive notion in this country that this condition is associated with military service, other people who have it, who've never been in the military, oftentimes feel, well, I can't claim that. I don't deserve to have that that title or that label or that diagnosis because I didn't, provide military service. I wasn't serving the country, so how can I even claim that? So we do try and dismiss or dispel the fact that, again, it's a myth. It's not just with people in the military. It can happen with anyone. Next slide, please. So what we're going to do now is to look at 3 individual cases. The first one is the case study of Grace. Grace is a 25-year-old Korean immigrant. She moved to this country to be with her husband, who was attending graduate school. She speaks very limited English. She has no social connections except for Joe here in the US. And Jay rather, is very, very busy. Jay's her husband, and he's very busy as a graduate student because he has a very rigorous course of studies. And so Grace really talked about missing her family, her life in Korea, her friends. And so she states that, she has difficulty sleeping and eating. She has no appetite. She's lost 15 pounds. She cries often throughout the day and she feels hopeless. She used to really enjoy communicating with her friends and family in South Korea and would really be very welcoming and eager for those weekly calls. But over the past 7 months, she really hasn't even wanted to speak with anyone in South Korea. So she really tries to avoid those calls. Now we can do the poll. What mental health condition do you think Grace has? Please select one. Okay, interesting little mix here, but the majority of you did say depression. So for those of you who chose depression, you are correct. That is the mental health disorder that I would diagnose Grace with based on the symptoms that she's shown. So what types of resources might you refer her to? Which one would best meet her needs? The HANA Center, which is a Korean American Human Service Agency, the local emergency department, Kanwin, which is a Korean American organization to address violence, domestic violence, or a local Korean American faith community. So which would you think would be the best resource for Grace? Yes, so any of these resources, could be a good resource for Grace. However, given what was in the case study, she was not coming from an abusive home or a home with violence. So Canwin wouldn't be the best option, although they would be able to refer her to a better option if they weren't the place to provide it. We definitely don't want to send Grace to the local emergency department because that can be even more traumatizing. So unless she's showing symptoms that really absolutely requires immediate medical intervention, the emergency department would not be the best place for Grace. And a local Korean American faith community, well, again, they're familiar with the culture and may have some resources, but they may not be the best place because, again, we don't even know if Grace is a person of faith or what her faith orientation is. So you're correct, those who said Hannah. Next case, please. So our second case, we have Gordon. Gordon is a 63-year-old African-American male with disabilities. He uses a wheelchair and he's used it for about 5 years due to multiple sclerosis. He and his grandson, Tyshawn, were sitting on their front porch playing cars, and a car sped by and opened fire. Gordon was grazed, but Tyshawn was shot in the chest. Both Gordon and Tyshawn survived their wounds, but now Gordon finds himself feeling irritable, always on the edge. He's reporting having frequent nightmares and daydreams about the incident. Anytime he hears a sudden noise like a car backfire or a car speeding down the street, he just shuts down. He just really shuts down. So what mental health condition do you think that Gordon might have? Yes, for those of you who have said PTSD, you are correct. In that case study, he may have certain elements of depression, although we really don't see that quite as much. It's really much more post-traumatic stress disorder, although, and we won't talk about this too much, but you can actually have comorbidities in behavioral health where you have more than one diagnosis. But in this case, it really is a matter of PTSD. So given the fact that he has PTSD, that's what we've determined, which would be the best type of job placement for Gordon? He's trying to go back to work. And you're his job coach, you're looking for the best placement for him. What would you recommend given his mental health condition? Excellent. Yes. If I was his, workplace case manager trying to help him find a new position, I would think office manager at a construction site, he may have the cognitive and social skills for that, but there's a lot of noise at construction sites. So we definitely wouldn't want to send him there. Recess monitor at school, again, if anybody's ever been a recess monitor, and I have in the past, children make a lot of noise and they play a lot of games, and sometimes they're violent games. And so for someone who may be experiencing flashbacks or have an aversion to noise based on their PTSD, that would not be the best site. And of course, we wouldn't want him to be a cashier at a local gun range. Yeah, definitely not. So I'm glad no one mentioned that. So you're all brilliant and absolutely correct. Information desk at a university library, because they tend to be mostly quiet. Next slide, please. So our last case study is Gabriella. She is an 18-year-old Salvadoran American. Her parents were born in El Salvador and came to the US fleeing violence. Gabriella's parents are undocumented and have been living in the US since 1990. Her family's immigration status is mixed because some of her siblings were born here and others were born in El Salvador. So they have a lot of fear right now because in their neighborhood, the immigration police, also known as ICE or La Migra in Spanish, have been really honing in on their neighborhood. And so there's a lot of fear right now because of the ICE presence in the neighborhood. And so her symptoms include fearing for her family's safety. She reports a constant sense of worry, irritability, and difficulty concentrating. She also feels a shortness of breath. She has hot flashes, chest pain, and she feels lightheaded. Based on this information, what mental health condition do you think Gabriella has? Yeah, so again, the majority have said anxiety, and that's what I would assess the situation as. I would diagnose her based on what she was presenting with as anxiety. There could be elements of depression or PTSD, but really what she's manifesting is anxiety. And the purpose of exposing you to these conditions is not to turn you into clinicians, because you're not, unless you actually are. This is not expecting you to be able to make a mental health diagnosis, but just to give you a bit of information so that if you do see some of these symptoms, that you might have some awareness of what it could be. So in this case, we have one more poll regarding Gabriella. Let's just take a look at that. So if you knew that she had this condition and that she was subject to panic attacks, what would you do if she had a panic attack or had this type of condition right in front of you? What would you do? Would you call 911 right away? Would you tell her to snap out of it? Would you tell her you've had panic attacks much worse? Or would you speak calmly and ask if this might be a panic attack and if there's anything you would be able to do to help her? Yeah, I see that, there was some people had an instinct to call 911 right away. And if you're a person who doesn't know Gabriella and she hasn't already told you that she has panic attacks, or sometimes, you've seen this happen before in the office, then you wouldn't have a way of knowing, and you might have that impulse to call 911. But think about the facts of the case. We know that this is one of the symptoms of her condition, that she does tend to have panic attacks. So if this is something that she commonly deals with, it's probably best to speak very calmly with her and, ask her or remind her if this actually might be a panic attack since she's had them before, and then ask her what she needs, if there's anything you can do right now, because that's giving her the power and control to deal with her own immediate situation. And she may tell you, I'm used to having these panic attacks. They're not great, they're not fun, but they're usually only a short period of time. So I just need to do some breathing exercises, or I just need to take my mind somewhere else and try a meditation technique, or I just need to sit and be calm in a dark room and wait it out. So whatever works for Gabriella is what you want to support for her. If she says call 911, then of course you want to honor that request. But if she's had these before and you're aware of that, then just try accompanying her, being present with her, speaking calmly, reminding her about the panic attacks, and just offering your assistance. Next slide, please. So if you are presented with a client who has a mental health condition, we already know that stigma exists around mental health for a variety of reasons. These are just a few of the reasons why a client might not want to disclose to you that they're actually dealing with a mental health condition. So the client might feel embarrassed, ashamed, vulnerable, or defensive. So they're just not going to ask you for help. The client might also fear that if they disclose they have a mental condition, will that result in a termination of services at your agency or a reduction in services? So will that person be looked at differently, or perhaps in a way of fear or avoidance? And so they may fear that you're actually going to terminate their case. Clients may also be concerned about confidentiality issues. Are you going to tell someone? Who are you going to tell? Do you have to tell someone? Are you going to call their spouse or their child or their sibling or their pastor, whomever? Is this information going to get out? So whatever your confidentiality policies are and your interpersonal experience with this client, you'll want to reassure them that what they say to you, that it's a safe environment. They may also really be afraid that you're going to view them with suspicion or disrespect, again, because we know that there are a lot of really negative stigmas about mental health that occur in society. And then there might also be some cultural stigma. So there may be a cultural taboo or inaccurate beliefs about mental health based on cultural ideals or religious beliefs that may cause the person to just say, I can't disclose that I have a mental health because my culture says it simply doesn't exist where I come from. Mental health, that belongs to that other culture or that other ethnicity over there. It doesn't happen in my community. So again, these are some of the reasons why a client might not actually disclose to you that they have a mental health condition. Next slide, please. So again, when we're looking at stigma in the workplace, it doesn't just occur with our clients. If you are a supervisor or even a coworker, it's important to think about this, in the organizational setting as well. So an employee might feel some of the same things that a client might feel: embarrassed, ashamed, vulnerable, defensive, so they don't ask for help. And you might have a really excellent EAP assistance, employee assistance program that your colleague or that your employee could take advantage of. But if they're too ashamed, embarrassed, vulnerable, or defensive to ask for that help, then they won't be able to access that resource if they don't know it exists. They again might also fear that if they disclose, what does that mean for their career? Will they be fired? Will they have an involuntary transfer to another location because nobody wants to be around the crazy guy? Are they going to have a reduction in work hours because someone might think, oh, you're just too stressed out, you have a mental health condition, you just can't work, so we're going to cut your hours, we're doing you a favor. Or that perhaps a promotion or some other advancement in their career might be withheld based on the fact that they have a mental health condition. They also may be unaware of policies that are in the workplace that can help them. So there could be organizational policies, union policies, if your organization has a union, and certainly governmental policies, looking at the Americans with Disabilities Act, for example, or Family Leave Acts, different things that can help support this person who's dealing with a mental health crisis. And again, they just may be unaware of the resources that are available. They just simply don't know what's out there because nobody that they know has disclosed to them, so they have no idea where to find available resources. Next slide, please. So we'll just go past that slide, and if there are any polls along the way, please feel free to do the polls. So when we're looking at creating a safe and welcoming environment, this is really important to create an environment where, whether it's an employee or whether it's a client, that it's a place that feels safe to discuss mental health. And you'll notice that I didn't say mental illness. And it should be a safe place to discuss that as well. But oftentimes for people, it's easier to frame it from the perspective of health, wellness, and positivity. And then as you do that, people may start to open up and say, well, actually, I'm really stressed right now, or actually, I'm really experiencing this right now. So really to start by framing mental health and use mental health in a way that doesn't separate it out from other aspects of health. So this is really about our integrated, health of the person. So some organizational strategies that you can use include providing mental health trainings in the workplace for employees, clients, and community members, because again, this helps to normalize mental health as a part of overall health. Also looking at what kind of policies does your organization have in place or can put in place to help promote well-being in the workplace. So educating staff also on these policies, like, oh, we have a mental health policy. For example, I used to work for an organization that had a mandatory mental health day that we had to take. I don't remember if it was twice a year or quarterly, but it was mandated and we could take it at any time for any reason, but it was there for us to use when we needed it. So that's just one example of an organizational policy. Looking at having resources on site for health, wellness, and stress management. Creating an organizational safety plan so that if you do have any type of violent kind of event, or if you do have an event where someone is escalating, that you know what steps to take in that situation. So organizations should have safety plans. And then consider check-ins and reflections as part of your team meetings. Also, at the individual level, there's steps you can take. So engage in self-care, because this helps to reduce burnout or vicarious trauma. So if you're in a situation in the workplace where you're constantly listening to other people's stories, and a lot of those stories indicate adverse childhood experiences or indicate current trauma, you can begin taking that trauma in on yourself where it becomes a vicarious trauma. So you're actually being traumatized by the experience of others' trauma. So it's important to attend to self-care to try and avoid those things. Know your own triggers and stress points. This is really key. So have the awareness to know what those things are for you so you can avoid them if possible, or minimize them, or give yourself the self-care that you need when you're experiencing those things. Build in mindfulness, reflection, movement, and activity in your workday. This is really key. This is why we opened up today's presentation with just a small exercise for mindfulness and to be centered, but integrating these things, throughout your day as part of a daily practice can be very helpful in dealing with stress, or avoiding stress actually can help reduce that because it's a coping mechanism. So listening actively to others around you and using trauma-informed inclusive language. So we remember Dr. Cruz from the video earlier. Instead of saying, what's wrong with you, or pointing a finger at someone else, or looking at them with side eye, you can be like, what happened to you? Feel free to tell me about your experience. And that's if it's appropriate in your workplace setting, or if someone discloses to you, but not to put yourself in a situation where in some way it seems accusatory or uncomfortable because you're using language that's not appropriate for the situation. Be knowledgeable about community and governmental mental health resources. So there are some links at the very end of the presentation that talk about a variety of different mental health resources at the local level in the Chicagoland area, as well as some national resources. So no matter where you are in the state, some of these resources will be applicable to you or available to you. Next slide, please. Oh, please feel free to have a poll if there's a poll next. Okay, when we look at mental health and trauma, we're looking at conversations, we're looking at observations. It's really important, again, to use those words like, what happened to you? Do you want to talk? Demonstrate care, concern, and empathy by talking about stress management, well-being, mental health, wellness, positive coping skills, because all of these things promote resilience. We want to remind the person that they have the capacity for resilience. Don't use words like, what's wrong with you? Or why do you act like that? Or just stop it. Or using other words that you might have heard kind of thrown around about people who we assume have some sort of mental condition. Oh, you're crazy, you're loca, you're loco, he's touched in the head, oh, psycho, sick, violent, criminal. So all of these types of language, these descriptors that are used to, stigmatize someone who may have a mental health condition. And, these are the wrong types of words. We should use the actual words: mental health condition, mental illness, or if we know what the disorder is, if it's been disclosed to us, certainly, naming that with the client if they've disclosed, but not using any of these negative descriptors. We also want to use observable signs in terms of mental health challenges. So we want to look at what is the client looking like? What are they experiencing? And so what they're experiencing, if they're having a mental health challenge, could be a variety of things, but these are some of the things that are common depending on the disorder. So not every disorder will have all of these, but sometimes people will experience delusions, meaning that they're picking up sensory perceptions of things that are very real for them, but actually are not occurring. So things that they see, that they feel, that they hear, that they smell. And when I say feel, I'm talking about actually like they might feel like little spiders are crawling all over them, or something that they feel is happening, to their body that's actually not happening. So these are all sensory delusions. Talking to someone who isn't there. If they have repetitive behavior, that could be a sign of a compulsive disorder. Having agitation and irritability, crying, seeming down or isolated, having a loss of interest. And again, going back to either weight gain or weight loss. Something else that you might see from a person who is experiencing a mental health disorder, but again, it depends on the disorder. Maybe they're not taking care of their hygiene, or maybe their appearance is more disheveled, whereas at one time they are always very put together, everything matched, they were the fashion icon of your organization, and all of a sudden they're constantly coming in with a more disheveled appearance. That might be indicative that something's clearly out of place for them. And then another sign that you can see in the workplace can include habitual absenteeism or tardiness. And that can indicate that perhaps the person is either having a lack of sleep, or that they're sleeping too much. Because if they're absent consistently or tardy, they may be experiencing a sleep issue. Next slide, please. So when we talk about an encounter with a person who might be having some sort of mental health issue, and it's not even just with mental health. This could be also if you have someone who is extremely aggressive in some sort of way that may not have anything to do with a mental health disorder. It could just be their personality. But these de-escalation techniques are suitable for both of those situations and help to promote a more safe environment. So the following tactics: first of all, remain calm. It's almost like human nature, if someone is yelling at you or someone is coming at you in an aggressive way, to sort of match in tone and style their behavior, but that actually will only escalate the situation. So if someone is very agitated, you'll want to remain as calm as possible. You also want to engage in active listening, because the experience of being present for another is really, really important. But as you're engaged in active listening, you also want to be sure that you're not staring at the person. So don't make consistent, eye contact, because someone might view that as a form of threat, or that may feel very self-conscious. So you might want to, look at something else in the room every now and again, so that you're not constantly staring at that person. When you're talking, you'll want to use I words rather than you words, because when you're talking about your I words, you're not putting it on the client and making them feel defensive. You're not making them feel stigmatized. You're talking about your experience of what's happening. And so it's important not to take the focus away from the client, but just make sure that you're not using traumatizing language or language that's pointing them out. Don't be patronizing. People, regardless if they have a mental health condition or not, most people can tell when they're being patronized, and it's not something that anyone likes. So, don't, if they're experiencing, something, don't act like you know what they're experiencing, because you really don't. You want to be empathetic, but you don't want to be sympathetic, and you don't want to be confrontational. You also don't want to try and convince the person that they are experiencing a delusion, because that delusion is very real for them. It's as real for them as what you're experiencing in reality is for you. So to try and convince them that they're experiencing a delusion really is not helpful. There are certain techniques that a trained clinician might use to help a person in that situation, but if you're not a trained clinician, then confronting someone's delusion, it's not necessarily going to be a safe or healthy thing for anyone in the room. Do not act as if you are a therapist or a first responder unless you are. Don't make any sudden moves, gestures, or actions, because again, that can seem to be very threatening to someone else. And again, you don't know what they're experiencing in their delusion. Also, reassure, but don't promise anything. Because if you're in this situation, you might want to promise them that everything's going to be okay, the police aren't going to be involved, you're not going to lose your job, you're not going to be kicked out of the organization. You might want to just say everything you can think that will make the person more comfortable, because again, that's human nature. But if you're promising things that you can't actually deliver on, that can only escalate the situation for the person, because they may feel like they're being patronized or they're being lied to. Assure the person in distress that they have choices, that they have options, that they have control. So, ask them things like, is there someone I can call for you? Or are there things that worked for you before? If you've been in this type of situation, what have you done before to make the situation better? What would you like to have happen next? So you're not actually promising them anything, but you're trying to keep them calm and safe until the appropriate first responder can arrive. And whatever your organization's safety plan is, make sure that you follow that plan. In these situations that are of a heightened aggression, or a situation that you cannot de-escalate using these tactics, it is important to maintain your own safety and the safety of others. So, call for additional help as needed. That might mean you're calling your security. That might mean you're calling 911. If you have a clinician on staff, that might mean you're calling the clinician. But just make sure you're following those steps. Please go ahead with the poll. So, what is not a helpful technique in de-escalation? Should we ask the client, hey, what's wrong with you? Should we make direct eye contact and stare at them at all times? Should we match the agitated behavior with our own tones and gestures, or all of the above? Yeah, so none of these techniques are helpful if you're in a situation that is, that is escalating. You want to de-escalate. You don't want to promote further escalation of the situation. So again, our trauma-informed language, we don't want to say what's wrong with you. We might say, what happened to you or what are you experiencing? We don't want to maintain direct eye contact at all times because that might further agitate the individual. And we certainly don't want to match the agitated client's tone and gestures because again, that just furthers to escalate the situation. Next slide, please. So if you are coaching a client that has disclosed to you that they have a mental health disorder, these are some helpful strategies for working with that client. First of all, we always want to approach the situation from a strength-based, trauma-informed, and positive regard approach. So we're promoting resilience, we're promoting strength. So we want to begin there. But we also want to be comfortable and honest when we're talking about the mental health disorder and what occupational implications there might be. So you don't want to, again, make things seem better or worse than what they really are. You want to really try and be accurate with the range of possibilities for a person with this particular mental health disorder. Don't, actually make things either more or less than what actually could be in this particular occupational implication. So be knowledgeable about what those things are. So again, like we talked about Gordon, Gordon, you might say, Gordon, I found this great job for you. We're gonna put you in the university library. You'll be at the front desk. It'll be chill. You can make some extra money. It's all good. But maybe Gordon says to you, I really wanna be, I've always wanted to be in construction. I love construction. I wanna be in that, and again, you wanna honor the client's choice, but you also wanna explain, Gordon, these are the reasons why I've selected this particular option rather than these. All of these choices are yours, but you might want to think about what it would feel like if you were constantly in a construction site, what type of noises, what type of sounds, how that might make you feel. And then Gordon might be like, you know what, I never really thought about it like that. Yeah, you're right. I think that university gig would be good for me. So don't pretend to know what it's like to have that mental health condition, even if you have the same condition, right? Because maybe you've either had that condition at some point in your life or you're currently living through that condition yourself. Even if you are, your experience with the condition can be very different than your client's for a variety of reasons. Maybe you have a support system that your client doesn't, so it helps you to manage your condition better or differently. So again, don't assume to know what it's like. Acknowledge that there are social determinants of mental health and the importance of cultural humility. So when I'm talking about social determinants of mental health, I'm talking about factors such as race, gender, ethnicity, immigration status, because the history and the experience of racism in this country and in other societies, actually, they don't promote positive mental health. They create triggers and stressors. And so it's important to understand how different cultural aspects may also contribute to both mental health in terms of resilience and resources that you can use from your culture to empower yourself, but also what are some of those stressors or triggers that may be imposed on your culture by a different culture. So again, this importance of cultural humility. When you're working with a client, set realistic goals and expectations. This is so very important because, again, you don't want to break your client's trust and confidence in your ability to be of service by promising something that, you know, is not a realistic expectation given where they are with that mental health condition. So mental health conditions are not, some of them are acute, meaning that they only happen at one particular point. They have a start time and an end time. Other ones are episodic, meaning that they may happen at certain points and may not happen for a long time, and then they come back and happen again at a later time. Or they may be chronic, like a chronic disease like diabetes, for example. So again, these can manifest in any of those ways, but it's important to understand that because if someone who's having an acute mental health condition right now, once they get the treatment they need, they may be able to have you know, more opportunities that are available to them. So again, realistic goals and expectations are important. When we look at how do we practice with the client, so practicing doing some role-playing exercises. A client might say, you know, I'm really concerned about going into that interview. You know, I have sudden tics. If a person has Tourette's, for example, and I don't know, you know, how that's going to play out. Well, you might want to be open and upfront with the person that you're interviewing, saying, you know, I have a certain reaction. I have a tic, but I'm, you know, it's part of my condition, but I'm here, I'm healthy, I'm, you know, engaged in our conversation. So please try to ignore that. So again, role playing what that would feel like and what that would look like. Also being knowledgeable of practices and policies such as the American with Disabilities Act or Family Leave Acts. Again, these things are policies that can be very helpful. Organizational-based resources such as employee assistance programs or wellness programs that your organization may offer. Again, these are very helpful things to be able to suggest to your client when you're coaching them and when you're being an advocate for them as they really deal with their mental health condition and seek to be productive workers and to strive. Next slide, please.
We actually have a little poll here before we move forward.
Yeah. So which is not a helpful technique in coaching a client with mental health disorders? Tell the client that based on their symptoms, you have diagnosed them with ABC, or reassure the client that their disorder will have absolutely no effect on their job prospects, or advise the client that their goals are just unrealistic, or all the above. Yes, classic answer. When you have all of the above, it's typically the right answer. Take it from a professor. So yes, and the reason why is, again, you don't want to tell them based on your symptoms, I, as your job counselor, have diagnosed you with, no, you don't have the training, you know, to diagnose anyone with anything. And even if you do have that training, but that's not your job function for the particular position you're holding at that point in time, you know, you don't want to offer a diagnosis, most definitely not. You don't want to reassure them that their disorder will have absolutely no effect because you don't know that. You really want to do your homework and find out what effect it might have, so that you can deal with the situation proactively and come up with strategies that might work. You also don't want to just advise them straight out their goals are unrealistic. You know, you have to couch that conversation. You don't know, if their goals are unrealistic. They might seem unrealistic to you, but it's important to have some conversation around it because maybe your client has some coping strategies and some techniques that you don't know about that can actually help them. So again, that's really important as well. So when we're making referrals, back in the day, we had a purple binder of resources, the purple book, that many social workers would go to as the Bible of social work with all the resources. But in this day and age, and because things are so static and you know, ever changing, technology is really one of the best tools we have for making referrals. So these resources here that I've provided for you are different types of community resource and referral platforms. Some of them require an organizational, an MOU, or may have a license or fees associated with them for your organization, but others are free for community-based organizations. So for example, Aunt Bertha's, if you are a community-based organization of some sort, you can actually put your community organization's profile on this website so that other organizations can see what services you have. But likewise, you can also go on, and when you're working with a client, you can find resources that may be above and beyond the scope of what you provide, especially when you're looking at mental health resources. Aunt Bertha's can be a really great tool for connecting the client with resources that are in their area, that are linguistically and culturally appropriate, that have sliding scales. So again, great resource, but feel free to check out any of these organizations after the presentation today. Next slide, please. So here are some of the resources that I mentioned earlier that would be helpful in making referrals. So NAMI is a national organization, as is Mental Health America. SAMHSA is actually the federal arm, Substance Abuse and Mental Health Services Administration. So there are a lot of great resources on SAMHSA. Emotional CPR is a wonderful training that's intended for lay people and helps them to know how to deal with people in present time who may be approaching with mental health disorders. And then there's some local resources in the Chicagoland area that I've also provided. Next slide, please. So Mental Health 101, self-care, stress management. Again, and I believe there's a poll here, but you might want to think about what are the various different self-care techniques that you utilize for your own practice. And after you've answered this, we're just going to open it up for question and answer, because I know that we have limited time left in the presentation today. So I want to make sure that you have an opportunity to ask your questions.
Those are the results. We have things all over the board.
So it sounds like you all have some really good techniques that you utilize for self-care. So it's important to know what they are and to utilize them often.
Excellent. So it looks like one of the questions that's come in is around, can COVID-19 be a cause of PTSD?
That's a really great question. And because COVID-19 is so new, there haven't been any studies really to indicate whether or not that would cause post-traumatic stress disorder. I think, and again, I'm giving you my clinical belief that COVID-19 is probably more likely to produce conditions around depression and anxiety than it is PTSD, but really only time will tell. And if you've had experiences of PTSD in the past, certainly living in a place, and when I say place, I mean society, our community right now, that has so much stress whether it's about COVID-19 or some of the issues around social unrest or those issues combined. If you've had a mental health condition in the past, it can likely be exacerbated under conditions of multiple stressors, such as we have right now. So it's possible that any condition that you may have experienced before may come back, or any experience that you're currently having in mental health, a condition around mental illness can actually be worsened because of increased stressors. So that's a great question. But I think time will tell really what the effects are of this particular situation with COVID-19 on mental health. But looking at other types of pandemics or major other catastrophes, there certainly are lasting mental health repercussions that we have to be cognizant of. In fact, one of the slides earlier in the presentation has several different, I believe 3 different YouTube clips on it. And one of the clips talks specifically about trying to understand that there will be repercussions after COVID-19 based on mental health. So great question. Any other questions?
Just had another one come in. Does general disclosing of mental issues, such as like on social media, affect an individual's job opportunities? Specifically thinking around that stigma piece.
Oh, that's such an excellent question. Thank you for bringing that up. You know, really, because there are some people in society that will hold mental health disorder against a person and think that they're less capable. But it's like, would you hold diabetes against a person, or would you hold macular degeneration or some other, you know, health condition against the person and think this is really going to impact their ability to do the job? And unfortunately, we don't give the same latitude for mental health that we do for physical health disorders. So it actually can have a stigmatizing effect. It really shouldn't be, but you know, unfortunately, in the wrong hands or the wrong person looking at this information, it certainly could be used to stigmatize. It could even be used to bully someone else. So I'm always very cautious about any type of personal information that you put on social media. But there also are resources via social media and, you know, support groups that may be online via social media that people might, you know, want to take advantage of. When I say take advantage of, I don't mean in a bad way. I mean utilize, you know, for their own sense of support and as a social network. So it's really a double-edged sword. Sometimes you can find really positive resources using social media to cope and contend with mental health conditions, but also it can be used against you to stigmatize. So I'd say it's really important to be judicious and you know, just to be safe with the information that you disclose. And, you know, if you disclose it, you know, trying to make sure that the groups that you're disclosing it in are closed groups, that you have to be invited in. That way there's an extra level of, I think, built-in safety and security, because everyone else is probably experiencing a similar or a different mental health disorder, but they're all there because they're experiencing that and they want help and they want support. So they may be less likely, of course, to traumatize someone else or stigmatize because they're there for the same reason. So great question. Any other questions I can answer for you?
Looks like those are all of the questions so far in the chat box. We'll leave this open for another minute or so. As we're filling this out, one thing I did want to just highlight, kind of re-emphasizing what Venansi had mentioned earlier, is just the importance of setting expectations with your clients and your participants, specifically when it comes to just the stigma of preparing them for what some of those stigma pieces that they might be unfortunately encountering in the workplace might be, but then also helping them to develop those individual strategies and working on building that resilience within them to understand, you know, what might be some of those coping mechanisms, or what might be like kind of their own emergency plan if something was to happen. So really just wanting to re-emphasize that, as well as thinking about how can we continue to advocate for our clients in the realm of workers' rights in regards to this. It looks like we have another question that's come into the chat box. What active steps can we take to remove the stigma in our communities?
That's really great. And there actually are a lot of anti-stigma around mental health campaigns that are sort of like public health announcements or sort of informational campaigns that you can access. And NAMI is a great resource for some of those types of campaigns, as is Mental Health America. So you may actually be able to find resources or posters, things like that you can put up, just the same way that you would put up rainbow stickers to show that you're an LGBTQI sensitive organization if you are, or some people are now putting up Black Lives Matter to show that they're sensitive to that. It's with mental health, there's certain signage that you can put up around to say combat mental health stigma now, or mental health is a part of health. I mean, there's all kinds of like slogans that people who are perhaps more creative than I have developed to actually utilize in office spaces, in faith communities. There's actually a wonderful resource called Trauma-Informed Congregations. So it's for faith communities and faith community leaders. So again, we've actually gotten to the point now where there's some really tailored information that we can utilize depending on the type of community. It can be based on if you're from a particular culture, there's certain resources to combat stigma from a cultural lens. So there's just really a lot of great resources out there right now. And some of the links that I provided you as resources would be a great place to start for looking at those things. But also just having, being open, being honest, and making your environment a place that feels comfortable to have these conversations, to normalize mental health as just a part of health, helps to destigmatize mental health. Because would you stigmatize, someone who had cancer? No, this is a health condition just like any other health condition. So it's important to reframe how we think about mental health. Thank you. Excellent question.
Excellent. Well, it looks like we have hit the 4 o'clock time. It doesn't look like we have any other questions that have come in. Thank you so much, Venancia. This was fantastic.
Well, thank you so much. I really appreciated having this opportunity to share this with you today. And again, apologies for the technical difficulties, but all of the resources that I discussed today, you will have links to all of those videos as well as the other resources in your presentation.
Thank you both.
Yeah, I'm gonna just turn it back over to you, Amy.
Well, just housekeeping items, just thank you both for a great presentation. Again, everything will be available on the ICSPS and WorkNet web portals. And then, as I stated earlier, there is going to be an evaluation that's going to be sent to you tomorrow, as well as a certificate of attendance. So if you have any feedback, please send that our way, because we'd love to bring you more great topics like this. So thank you both so very much, and thank you all for attending, and have a wonderful afternoon. Hello.